Hi friends, I'm Priya Mistry, the TMJ doc, and today I'm going to talk to you about orthodontic treatment and TMJ disorders. I see many of you asking questions about how braces or Invisalign can affect TMJD, if they can make it better, if they can make it worse, etc. Your questions inspired me to make this video to provide some clarification on this. Watch this video until the end to find out more about how braces or Invisalign can affect TMJD. For those of you who don't know me, I'm a general dentist with a practice in Portland, Oregon, where we are dedicated to taking care of patients with TMJ disorders. I practice here with my wonderful mentor, Dr. Arthur L. Parker. If you don't already, be sure to follow me on Instagram. I post here about TMJD quite frequently. My Instagram handle is _TMJ_doc. Also be sure to check out my Twitter, tweet. My Twitter handle is @PriyaTMJ. I post lots of useful information on TMJ disorders, tips, trivia, etc. So if you like to nerd out on this stuff like I do, be sure to check out my social media accounts. That being said, if you're looking for more information on TMJ disorders, then this is the YouTube channel for you. Hit that subscribe button as I post a new informative video every Friday for people who are suffering from TMJD. So let's get right into it. A good place to start is the relationship of the bite, or how the teeth fit together, to the temporomandibular joints, the TMJs. Our teeth fitting together like cogs on a gear and the two jaw joints create what we call at my practice the tripod effect. What happens when you cut off one leg of a tripod? The whole system will go out of balance. With that analogy in mind, it totally makes sense that the bite, the way the teeth fit together, could have a positive or a negative impact on the TMJs. I want to stop here and say that the bite is just one factor that could be contributing to TMJD. Other factors, especially hormonal influences, postural dynamics, whiplash incidents, and more, contribute to TMJD as well. So I don't want anyone running out and blaming their orthodontist for their TMJD issues. That is not the purpose of this video. I've seen it go both ways. I've seen patients whose TMJD has improved with orthodontia, and I've seen patients whose TMJD has worsened with orthodontia. It can be highly unpredictable as to which way it goes, especially given all of the factors that contribute to TMJD. One thing I will say is that many of our TMJD patients had their first premolars extracted, and then all the other teeth removed to then fit together. The way this was done was by pulling everything back to close the gaps where the premolars were. This type of orthodontia is called extraction retraction orthodontia, with extraction referring to extracting those first premolars and retraction referring to pulling the front teeth back to close the gaps where the premolars were. If you think of the upper arch and the lower arch as a box that houses the tongue, that box is essentially made smaller by extraction retraction orthodontia, while the tongue stays the same size. So that begs the question, where does the tongue go? Well, there's only one place it can go, and that's the air space behind the nose and the mouth. That's called the nasopharyngeal airway. Because the tongue is now crowding this space, that airway becomes more narrow, which can then increase the risk for having sleep apnea. Sleep apnea and struggling for oxygen at night increase stress levels in the body. This increased stress can then cause increased clenching and grinding activity. Grinding the jaw, the mandible, forward actually opens up the airway. Think of the chin tilt that's taught in CPR courses. Same concept. All of the increased clenching and bruxing activity puts too much strain on the muscles and the TMJs, thereby causing TMJ disorders. Another negative impact of extraction retraction orthodontia is that forward growth, which is ideal for the anatomy of the temporomandibular joints, is stopped. The mandible, this entire jawbone here, is held in a position that's further back than ideal. This makes it so that the bony knob that our mandible ends on, the condyle, is in a posterior or too far back position within the joint. When the condyle is posterior or distalized, the articular disc that sits on top of it can displace more easily, leading to popping or clicking noises or the jaw actually locking closed. For more information on both of these conditions, please watch my videos Jaw Joint Noises, Snap, Crackle, Pop, and Jaw Locked Closed, parts 1 and 2. Again, I want to take a moment to make it crystal clear that not all people who have had extraction, retraction, orthodontia will end up with sleep apnea, jaw joint noises, or the jaw locking closed. I myself had extraction, retraction, orthodontia. I do not have sleep apnea. I have a mild click pop in this right joint with a little bit of pain sometimes, and my jaw has never locked closed. So please do not use this video or this information as a reason to blame anybody for what you may be going through. This video is about one of many factors that will contribute to TMJ disorders. Lastly, I wanted to talk about phase 2 of TMJ disorder treatment. Phase 1 is getting out of pain and stabilizing the temporomandibular joints, the TMJs. That means getting the muscles back in a functional, healthy, and pain-free state, and eliminating jaw joint noises and locking episodes. Once this is done, phase 2 can commence if the patient wants it. Phase 2 consists of creating a bite that holds the muscles in their functional state and holds the joints in their stable state. That way, teeth, muscles, and joints are all working together harmoniously. This can be done by orthodontia or by full mouth reconstruction, also called FMR. Since this video is about orthodontia, we'll focus on that. Phase 2 orthodontic work is typically done by a skilled and trained TMJ dentist or an orthodontist who is working with the TMJ dentist that provided phase 1 treatment. This orthodontic work is done in a very precise manner, and it creates a bite that supports the healthy and functional muscles and joints. Orthodontia, if done correctly, can do wonders for people who have suffered from TMJ disorders. That begs the question, do you have to do phase 2? Do you have to do orthodontia or full mouth reconstruction? And our answer is no. We try to be very careful to not change our patient's bite with phase 1 treatment so they don't have to commit to phase 2. However, sometimes it does happen. So it really depends on whether the bite changes and if it changes significantly enough to where the patient cannot function anymore. So phase 2 can be optional, and sometimes it's not so optional if the bite does change with phase 1. So that's really it, my friends. If you like what you heard, if you learned something new, click like below, subscribe to my channel, do all the things. Questions and comments are always welcome. And remember, my friends, you can never have TMI about TMJ. Thank you.